Hello dear patients, today we are going to review the topic of bruise on penis. A young man came to us. After having sex he had rash on penis. It stays there for about a year, maybe a bit more. It doesn't bother him at all. Sometimes there is a slight itch in the area of rash. However, it remains on its place. He tried different external softening creams and even hormonal creams without a significant effect. What do we see here? This man is quite young, and we see a brownish spot with a white center, in which there is a more white skin, in comparison with the skin around this spot, with elements of such a light skin atrophy, I would say so. On the background of this brownish spot with small brown spots, we see telangiectasias, dilatation of vessels. What it is? This is a disease or condition that is related to pigmentous purpuric dermatosis, when the capillaries are mostly affected. It is mostly described on legs, on lower extremities, less commonly on upper extremities. It is often called Schamberg dermatitis or pigmentous purpuric dermatosis, telangiectatic purpura of Majocchi, etc. The sense is that small capillaries are affected. In this case, it's mandatory to do analysis for disease of vessels, diseases of connective tissue, in order to exclude them. This was done for this patient. If the condition is normal, then from scientific point of view, this condition can be classified as purpura annularis telangiectasis of Majocchi, as the presence of such spots is characteristic for it with external atrophy and dilatation of vessels along the periphery. However, this doesn't have a significant importance, as this patient needs to get rid of it. Both himself and his periodically changing partners don't like its appearance. So, what works here? First of all, injections of vitamin C. Secondly, ascorotine medication internally. Thirdly, these are medications that have vascular action. For example, one of the most effective of them is nicotinic acid in injections. This is calcium gluconate intramuscularly or intravenously. In some cases, during such conditions, ozone is used with good effects. In some cases, external hormonal ointments are used, or modern ointments that have anti-inflammatory action, analogues of hormones by type of Elidel. So that was the treatment that was used for this patient. The terms of resolution of this element are around 3.5 to 4 weeks. It's no doubt that this element resolves slowly, because the blood that came out must be completely absorbed by skin cells, macrophages, etc., and digested by them. Quite a lot of time is required for that, and it is also required that the new portion of erythrocytes does not get into the skin. Therefore, the range of such vascular lesions, particularly of small vessels, more often is described for all lower extremities. But considering that our clinic is mostly directed at treatment of sexual organs, then it's also met on sexual organs that are quite closely anatomically located to sexual organs, where such diseases are quite often described. This patient did not have such rashes on his lower extremities. If it is necessary to diagnose and treat different rashes in the area of sexual organs, you can consult dermatovenerologists and urologists of our paid medical center of Dermatovenerologic Dispensary in Moscow. We have experienced specialists who do diagnostics and treatment of such rashes. We are waiting for you in our clinic. Please subscribe to our channels on YouTube and Instagram. Thank you for your attention.